Welcome back. Now, the National Professional Teachers Association of South Africa, or NAPTOSA, says that it's unfortunate that government has not included teachers in the first group that will receive the coronavirus vaccine. NAPTOSA also says that members are caregivers for millions of children, and with schools reopening, educators will also be on the front line of the pandemic. In addition, the South African Democratic Teachers Union, or SADTU, is concerned following the death of a matric exam marker in KwaZulu-Natal from COVID-19, and it's now calling for a halt to the marking process. SADTU says it is also worried about schools reopening this month. So let's discuss all of this further with NAPTOSA, their Executive Director, Basil Manuel, and SADTU's General Secretary, Mugwena Maluleke, join us right now. Gentlemen, thank you for your time. Welcome to Morning Live.
Good morning. Pleasure to be with you.
Let me start with you, Mr. Manuel. Please talk to us about your call for educators to be among those first in line to receive the vaccine. We spoke to Minister Zweli Mkhize, the Health Minister, last week, and he explained why it was important that healthcare workers be first in line for that vaccine. But you have expressed your concern that teachers in this particular instance, as per that explanation, are not necessarily considered frontline workers.
Absolutely. What we are concerned about is that we are not mentioned. We are absolutely happy with the fact that healthcare workers must be right at the top of the list. However, when you consider that teachers are in a dense environment where we are working closely with many bodies, especially in the secondary schools where we have young adults that are really infectious, and so too then the risk factors are much higher. We believe that we should be included in that group at the top. Over and above that, the rationale for this being that, number one, of course, we can't afford to have schools closed indefinitely again. Now, secondly, we've got to recognize that we have a lot of catch up to do from 2020. But more importantly is our role as education in the economy of the country. We know that the economy is an essential cog, and that without the economy working, the entire country suffers. And teaching and schools being open are part of that cog that makes South Africa work. And so we cannot be neglected and looked at too far down the line. So our call has not been to muscle out anybody at the top, but rather to be included in the group near the top.
So just to pick up on something you mentioned there about the rationale and it not being to have schools closed indefinitely. I mean, there has been concern about this particular factor as well, given the second wave, given the rising number of infections and, of course, fatalities as well. Let's talk about that and whether you believe at this stage, given your concern around the vaccine and how that will be rolled out, are you concerned that schools may not reopen at the appointed time as we speak?
NAPTOSA has always said, and I think we've been joined by all the other unions, that it's about health and safety. And if all the health and safety measures are in place, then schools will reopen and must reopen. And hence our role as custodians in terms of checking to see that every single provincial department and the national department is following through with what they already know. We don't want to go down the debate of PPEs and cleaning materials and are schools sufficiently ready and sufficiently clean. We are now simply checking. And part of that checking is, together with SADTU and the other unions, we will release a survey early this week where we are asking our principals and members to tell us what they have in schools. Are they ready for the reopening of schools? In addition to that, of course, we are also saying to the department, what have we learned from 2020? We must elevate that discussion beyond simply PPEs to say, we've learned about online teaching. Shouldn't we be talking more about that rather than the basics? So yes, we want schools open, not at all costs, of course, because we must ensure that the health and safety of all teachers, all education workers and the learners are being looked after. And that is the bottom line.
Ms. Maluleke, to bring you in here, so a matric marker, we understand, has died from COVID-19 in Escort in KwaZulu-Natal, and you're calling for the marking process to be halted altogether. So what have you noticed about safety protocols at marking centres? All right, we seem to have lost Mr. Mugwena Maluleke, but we'll come back and perhaps I can put that question to you as well, Mr. Basil Manuel, regarding the matric marking process. And that, of course, got off to a bit of a shaky start with 1,000 or more markers actually withdrawing before the process started. So now, with one person having died, what is the situation around the matric marking process?
Before I come to escorts, just generally about the marking process. In fact, it's going much better than we would have expected. Given that we are in the eye of the storm, so to speak, in terms of the second wave, we had expected far more disruption, and it in fact hasn't happened. What we have seen is sporadic incidents. The issue in escort is a great tragedy that it appears as though somebody who was ill already arrived at the schools. And this is where the call comes in. We can't expect only the center or the department to look after health and safety. We, the members who are there on the ground, if we don't look after our own health and safety, then we are party to the problem. And now we've seen somebody actually tragically passing away and a number of other educators infected, which is a great, great tragedy.
Now, Mr. Maluleke, if you are there now, just to speak a little bit more about that, the health and safety of teachers and the statistics that I have in front of me, 1,700 teachers having succumbed to COVID-19 related illnesses, more than 300 having contracted COVID-19, more than 300 died since the school holiday started. So can you just give us, a better sense at this stage of exactly what the statistics are from your organizations regarding teachers that have contracted and or succumbed to COVID-19? Now, we seem to have a problem with Mr. Maluleke, unfortunately, and we do apologize for that because we do seem to have him, but for some reason unable to feed him through onto the main discussion. But Mr. Manuel, that means we continue, you and I, with this discussion, because I'd imagine that all of the unions do get together and you do reconcile these numbers. So what are the latest statistics in this regard?
First of all, let's acknowledge that given the time of year we are in, the statistics are probably not 100% up to date, but 1,750 is what we have. And that, of course, already spells a huge number. And it's not only about people passing away, it is also about what is left behind. And what is left behind is devastation in schools. There are children who are going to arrive at school to find that their teacher's no longer there. And we don't have the resources to ensure that all those children will be counseled, or in fact, even those teachers. Then there's the replacement factor of those teachers. Depending on the type of subject, depending on where it is located, that may be another issue that comes to plague us. And we want to see that there's a teacher in front of every class when we reopen schools. And that is where our concern lies in terms of the mortality that we have seen to date.
So with that in mind, how is that likely to impact the reopening of school?
Well, we hope not severely. However, depending on how many people have been lost and depending on what subjects these teachers were offering. Can you imagine being in a rural school and a physics teacher has passed on? What are the chances of getting a physics teacher in the next week? And that is where the real nub lies. The problem lies not in so much as finding a replacement teacher, it is finding the right teachers. Then, of course, you've lost years and years of experience as well. And this is the other problem that comes to the fore. Because whilst we must bring new people in and we must ensure that our new teachers gain experience, the reality is also that we can't afford to summarily lose large swaths of our experienced teachers at a time.
So, Mr. Manuel, I would imagine that it is critical that you do engage both the Department of Basic
I'm back
Education.
now.
I see. I hear Mr. Maluleke.
Mr.
There he
Mugwena
is.
is back,
Yeah.
and I will give him the opportunity.
Well, third time lucky, as they say. So let me put the next question to you. Thanks for joining us, Mr. Maluleke. So I was going to ask about engagement with, of course, the Departments of Basic Education and the Department of Health with regard to the question of frontline workers and vaccines. So have you engaged these two departments, and to what extent at this stage?
Thanks for the question, and I really apologize for having been cut off. My network is very poor today. It's Monday. Look, we haven't had any serious discussion, basically, with the Department of Basic Education and the Department of Health. We had hoped that this week we'll be engaging them together with our own physiologist and epidemiologist that we're working with last year, so that we begin to understand how best we are going to deal with the issue of the vaccine. Clearly, it is that from the union perspective, is that we need the vaccine for the frontline workers, and education, increasing the mobility, as you would be aware, we bring more numbers, and therefore that in itself may present a challenge to the teaching fraternity if we don't get the vaccine on time. And therefore, we are going to have to engage and make sure that the teachers are also in the priority list in terms of this particular vaccine. We see it as a public good, and therefore we would also engage the department and the Department of Health to ensure that we engage our own medical aid scheme, in particular GEMS, to ensure that they roll out this particular vaccine as soon as possible, because with the second wave and these new strain, I'm told we must not call it a strain, however, it's also affecting our learners. In the previous year, our learners were not seriously sick, but we are experiencing some problems now with young people getting sick and some of them passing away. So yes, the vaccine is a public good and we need it urgently.
So how serious a matter is this to the extent that your members would or would not withhold their services unless they are actually prioritized for this vaccine? Is it likely to come to something like that?
Well, I do not think that it will come to that, given the fact that we have had experience in terms of the fact that when we are at work, we have got protocols that we are following. And as long as we follow those non-pharmaceutical interventions and we keep on making sure that we push our government to procure these particular vaccine, our members have always been in the forefront of making sure that they want their learners to be at school. We have seen many of the high schools, they didn't wait for the 25th as the reopening of the school. They are beginning on the 18th. Can you imagine? They are now beginning outside the set date because they are aware that the grade 11th have not been able to complete some of the proficiency levels that they need to have as they go into grade 12. So always the teachers are improvising, and the school management team is always, despite the fact that they're burnt out, despite the fact that indeed they have got fears, they are always coming to the floor and then saying to the nation, we are here to serve, and therefore we need to be able to support them. So I have not had, I don't know if Basil have had any of our members saying that they are going to demand that they will not be coming back until the vaccine is there. And obviously it can be said by somebody who joined teaching, not understanding that teaching is about caring and teaching is about building the nation. It can be said by a populist and a demagogue for that matter.
So given that, as you say, some schools have actually been proactive and will be returning next week as opposed to the week after, what sort of engagements have you had as SADTU with stakeholders at the various schools, the educators and also other stakeholders in terms of making sure of the safety of learners and teachers? Because I know Mr. Manuel said earlier, at this point, you don't necessarily want to be talking about PPE and the like, but these are the realities that you need to ensure that everything is in place.
I agree fully with Basil. I agree fully that we shouldn't be arguing, we shouldn't be fighting with the department. These are the ABC that we have seen in 2020, and therefore they should be in place. And clearly it is that any other school that doesn't have water, that doesn't have sanitation in 2021 will be an indictment to the department and to the government itself. And clearly it is that we'll be going back to the same situation. If a school is not ready, it cannot be reopened because you cannot risk the people. And clearly it is that this time around, the department must take full responsibility. If a school is not going to be reopened because they don't have the PPEs, because they don't have good sanitizers, and they don't have the screeners in there, because they knew very well that they have built that particular experience and expertise from those that were working last year, and therefore we shouldn't be really arguing about these particular issues. However, our monitoring teams are on the ground to making sure that as all unions, we get reliable information about schools that may be affected, and therefore we take proactive steps immediately to ensure that before the 25th, all schools are ready, and if they are going to be adopting a flexible approach in terms of hotspots areas where the possibilities that they may not be able to have a number of grades and so forth, maybe have 1 grade or 2 grades, that should also be part of the discussion we're going to have with the department. From today, we are going to be monitoring for the next 14 days in terms of how the numbers are going, because it's important to see the numbers declining as we are reopening the school, because we need to be also setting in place our tracking and tracing system in place so that we don't have more new cases, but rather deal with those cases that are there. The other thing that we may not have discussed with the unions, basically, it is that it's helpful that the medical aid must also test. It must be mandatory for the medical aides to test the teachers before they go, because we have seen in the marking center where the Eastern Cape has tested and being able to avoid a crisis that we're beginning to see, as Basil was saying, it's a very regrettable situation in Escort.
And just a final one very shortly, Mr. Manuel, with regard to the content backlog from all the time that was lost last year. How are the plans looking with regard to catching up this year?
At first, schools are all different, and schools have reached different places. So it is incumbent on the schools to ensure that the teacher that is receiving will know what was not covered in terms of the specific essential building blocks. Not everything is going to ever be covered, but there are those critical areas that we must cover because they are part of the ongoing learning in a particular subject. And many schools started that process before they ended, and they will continue with this to ensure that we are starting at a place where we take the children from the previous year with us into the new grade and not leaving gaps behind, because that gap will remain forever if we don't sort it out in this year that is now upon us.
Well, we'll leave it there. Thank you so much to Basil Manuel from NAPTOSA and Mugwena Maluleke from SADTU talking to us about their concerns relating to teachers not being in the initial phase of inoculation rollout, as well as other coronavirus-related issues affecting our basic education.